Does fat transfer actually last? So I've been getting a lot of questions about fat transfer. The answer is yes, but when done by an expert in an expertly fashion. Fat transfer has been done for a long time, but over the past decade, our understanding of fat, how to process it, how to inject it has definitely evolved and improved. I utilize fat transfer in a majority of my face and neck lift cases. Fat transfer, a lot of people say, oh, I could just do a fat transfer instead of filler, or I can do fat transfer as a standalone procedure. I rarely recommend fat transfer as a standalone procedure, and let me tell you why. Fat transfer is a phenomenal option when you're doing things like a facelift and full facial rejuvenation. The way fat transfer works is that we harvest some of the fat for your body, we purify it different ways. I personally like to add PRF to it, which is studies have showed higher longevity of the fat. And the biggest issue with fat is predictability. Anywhere from 30 to 50% of the fat that we inject will take. Questions that I often get is, will it take in one area and not the other area? Well, that really depends on injection technique. And if injection technique is done by an expert, it really should take uniformly. What about lumpiness and clumpiness? Fat belongs deep. And people talk about different layers of fat injection, but truly, most fat injected should be deep. You may have heard of something called nanofat. Nanofat is not actually fat. Nanofat are the precursors to fat cells that have some stem cells around it. Nanofat injections can be used for very subtle augmentation of the environment that you're injecting, just to kind of improve the vascularity of the environment, but it's not really added volume. A lot of patients ask me, does fat transfer last? Or I've heard it doesn't last. And I can tell you and show you from my own patient results that fat transfer often will last permanently. We never over-inject fat in the off chance that someone has a really high take rate, and less is more when it comes to volume, and everybody really understands that. In summary, fat transfer is an amazing adjunct to facial rejuvenation procedures. It can be used for all over the face. I usually like it at the temples, forehead, under eyes, smile lines, lower face, and jaw, but also can be used in the back of the hands and in the neck. So if you're interested in a fat transfer with or without facial rejuvenation procedures, definitely reach out to book a consultation, and I'd be happy to answer any questions that you may have.